is formed by the dorsal or ventral ramus of C5 to T1.
Ventral ramus.
Ventral ramus of cervical 5 to thoracic 1. Clear? So root, trunk, division, and cords. Root, trunk, division, and cords. Okay? Root, trunk, division, and cords. So how many roots here?
Five roots.
Five roots. That means C5 to thoracic 1, isn't it? Okay, there's sometimes there is the term like prefix, postfix. What's prefixed? যদি cervical 4 entry করে. Okay, cervical 4 যদি add হয়, this one is prefix, or postfix thoracic 2 পর্যন্ত যদি আসে. So this is not important for your exam. Just pre means cervical 1 when cervical 4 when attach, this one is called pre, and post means thoracic 2. So no need for your exam. This is not come in your exam. Okay, fine. So first thing is ventral ramus of cervical 5 to thoracic 1, and the brachial plexus situated in the base of the axilla in close relation with first rib and clavicle. তিনটা কথা বললাম, 3 words: base of the axilla, first rib, and clavicle. এদের close relation এ brachial plexus lies. Clear? এটুকু বুঝছেন? Okay.
জি ভাই।
এখন আসেন roots. Regarding root কোথায় থাকে? Where is the root lies? In between two
Scalenus
muscles,
anterior and scalenus
Scalenus
medius.
anterior and scalenus medius এর মধ্যে আমাদের rootটা থাকবে. Clear? Okay. Root কয়টা? How many roots?
5 roots.
Okay, fine. So now come regarding trunks. How many trunks? 3 trunk.
3.
Trunkটা কোথায় থাকে? Where is the trunk situated? In the
Root of posterior triangle.
root of the posterior triangle. Okay. In relation with which artery?
Subclavian artery.
Third part of subclavian artery. Kichu boy, some of the books told that this one is related with second part of subclavian, but actually this one is the third part of subclavian artery relation e thake. Clear? Okay. So this is trunk. How many trunks? 3 trunks.
3 trunks.
Regarding trunk, I have told 2 to 3 words: root of the posterior triangle, third part of subclavian artery, and 3 trunk. Okay. So upper trunk, middle trunk, and lower trunk. Regarding the middle trunk, keep it in your mind, middle trunk is alone or orphan, মানে এতিম। ঠিক আছে? Middle trunkটা কি? It's orphan, it's এতিম. Okay? Clear? আমি একটু পরে explain করব. Okay, now coming regarding division. How many divisions?
6 divisions.
Each trunk, how many division?
2 divisions.
2 divisions. So why I tell middle trunk is orphan? Because you see here, upper trunk is formed by C5, C6, middle trunk only by C7 only, and the lower trunk C8, T1. That's why I have told middle trunk is orphan. Clear? অর্থাৎ upper trunk তৈরি করবে C5, C6 মিলে, middle trunk only by the C7 and the lower trunk by C8, T1. তাহলে এটা এতিম না? একা তৈরি হয়েছে। Clear? Okay. Each trunk will be divided into how many parts? How many divisions? 2 divisions. Okay. কোথায় তৈরি হবে?
Clavicle এর পিছনে।
Clavicle is just behind the clavicle, and division is very small portion, so it's very difficult to identify. Okay, just keep it in your mind. The division will lie just behind the clavicle. Okay. How many divisions? 6 divisions. ঠিক আছে? Okay. So regarding trunk lies in close relation with first rib. That means first rib এর উপরে থাকবে, clavicle এর পিছনে থাকবে. There are some pathological conditions where the trunk may be compressed. Can anyone tell me কোন ক্ষেত্রে, what's the reason for the compression of this trunk?
Apical growth in lung.
Apical growth, that means যদি lungs এর মধ্যে কোনো pancreas tumor থাকে or bronchogenic carcinoma থাকে, pancreas tumor of the lung, apex of the lung এর মধ্যে tumor থাকে, then যদি সার্ভাইকাল রিপ থাকে,
cervical rib,
ওকে ওকে, লিম্ফোমা থাকতে পারে,
compression,
হটকিনস ও
lymphoma.
নটকিনস অর ফার্স্ট শিপ কম্প্রেশন, এটা কোনো আইট্রোজেনিক কারণে কম্প্রেশন হতে পারে। যদি কোনো কারণে কম্প্রেশন হয়, if the trunk is compressed, what will happen?
Tingling, numbness in the hand.
কিংলিং
Muscle
নামনেস
wasting.
তৈরি হবে,
tingling and
Muscle
numbness
wasting হবে,
sensation হবে। যদি সিভিয়ার কম্প্রেশন হয়, there
মাসল
will be
ওয়েস্টিং অফ
significant muscle
Muscle
wasting
ওয়েস্টিং
in
অফ
the
হ্যান্ড,
area of their
Hand.
supply. পুরো হ্যান্ডে নাও হতে পারে, তাদের ডিস্ট্রিবিউটিং এরিয়াতে কি হবে, ইনিশিয়ালি there will be tingling and numbness অর্থাৎ কম্প্রেসিভ মায়োপ্যাথি হবে, followed by small muscle wasting in severe compression. Clear? কোনো question? Okay, fine. Regarding cord, okay, posterior division of all trunk, you see posterior division of upper, middle and lower tongue will form which cord?
posterior
cord. অর্থাৎ posterior division of all trunk will create posterior cord. Anterior division of the upper trunk will create anterior division of the upper trunk. Only the anterior division of upper trunk will create lateral cord, and the anterior division of the lower trunk will create medial cord. Our posterior division of all trunk will create
posterior cord.
posterior cord.
Posterior cord.
Okay. So why we are telling medial cord, lateral cord, posterior cord? কেন আমরা বলতেছি, কার সম্পর্কে? In which relation we are telling that this one is lateral, this one is posterior, or this one is medial cord?
Second part of the axillary
Second
artery.
part of the axillary artery. Clear? এই কথাগুলা সারা জীবন throughout your life, এই কথাগুলা খেয়াল রাখবা। লেকচারটা বারবার repeatedly you have to hear this lecture. Okay, after that there will be a clean cut conception. Okay, fine. That's it. So some of the nerves merges directly or originates directly from the trunk. কোন nerve directly trunk থেকে আসে?
Median nerve.
তো একটা হলো লং থোরাসিক নার্ভ,
সরাসরি root থেকে আসে?
লং থোরাসিক নার্ভ,
Long thoracic nerve comes directly from the root. Which root?
C5
C5,
C6
C6
C7
and C7. Upper trunk থেকে কোন nerve আসে? Subscapularis and subclavius. ঠিক আছে? These are the small nerve. These are not so much important for your exam, but this one is very much important for your exam. Long thoracic nerve comes directly from cord. নাকি?
root
Root.
Okay.
Okay. Root থেকে আসে। Directly it comes from the root. So this nerve supplies which muscle?
serratus anterior muscle,
Serratus anterior muscle. Okay. So what's the function of serratus anterior?
Pull forward the scapula.
আর
serratus
abduction কোনো
anterior- overhead
Yes.
abduction
overhead abduction along with which muscle?
along with trapezius.
Trapezius muscle. Excellent. That means forward pulling of the scapula as well as in overhead abduction, it works with along with trapezius. ঠিক আছে? Nerve supply, long thoracic nerve. Okay? Long thoracic nerve আরেকটা নাম কি?
long
the
scapular nerve,
what's the nerve of heaven? Long scapular nerve হচ্ছে thoracodorsal nerve. Don't mix with long thoracic. Clear? Long scapular nerve is
Clear, ভাই।
thoracodorsal. এটা supply the latissimus dorsi কে, not serratus anterior. Long thoracic nerve এর আরেকটা নাম কি? What is nerve of heaven?
long thoracic nerve এর আরেকটা নাম nerve of heaven.
হ্যাঁ, nerve of heaven হচ্ছে long thoracic এর আরেকটা নাম। Okay, because you see here, look at me. When we make prayer, okay, so we use this muscle, so nerve of heaven. Okay, so if the long thoracic nerve injured, what will happen? Winging of the scapula.
Winging of the scapula.
কোন winging-টা হবে in case of long thoracic nerve injury তে? Medial winging. We will discuss it later, no worries. Just আমার সাথে These are the very much important for exam. Medial winging of scapula. Lateral winging কখন হবে? When lateral winging will happen?
ট্রাপেজিয়াস ইনক্লুড হলে ভাই
Trapezius or dorsal scapular
dorsal
nerve.
nerve.
Okay, so medial winging হবে long thoracic nerve or nerve to the heaven or nerve to serratus anterior যদি injured হয় সেক্ষেত্রে, but lateral winging will happen if spinal accessory or dorsal scapular nerve is injured. Clear? Okay, fine. So এই কথাগুলো আমাদেরকে খেয়াল রাখতে হবে, এই কথাগুলো ভুলে গেলে আমাদের একদম চলবে না, চলবে না এবং চলবে না। Okay, fine. So lateral cord is formed by which division?
Anterior division of upper trunk.
Okay. Posterior cord is formed by
all divisions,
Posterior cord of all
posterior
trunk.
division of all trunk.
all trunk. Okay. ঠিক আছে? So posterior division of all trunk তৈরি করবে posterior cord. So from here you have to know radial nerve, ulnar nerve, medial nerve, musculocutaneous nerve, axillary nerve, long thoracic and thoracodorsal nerve. এগুলো details আপনাদেরকে পড়তে হবে. You should go through the details of these nerves. Clear?
ল্যাটারাল কর্ডটা কি তৈরি করছে?
Sorry.
ল্যাটারাল কর্ডটা
Anterior division of upper trunk will form lateral cord.
জি ভাই,
ঠিক আছে?
জি ভাইয়া।
Posterior division of all cord, upper, middle and lower will create posterior cord, and the anterior division of lower trunk will form the medial cord. ঠিক আছে? Clear? Okay. So is there any confusion?